Hi everybody, thank you for joining us today. I'm Nancy Sasaki. I'm the Executive Director at Alliance Healthcare Foundation.
Hello everyone, I'm Sylvia. I'm the Program Officer at Alliance Healthcare Foundation.
And we've got a really great show for you today. In fact, it's going to be very interesting. If you don't know what that reference is, look up Laugh-In. You know, it's a few years ago, just a couple. Anyway, you can like us on Facebook, you can connect with us on LinkedIn, you can follow us on Twitter, you can look at our Pinterest board. You know, we're everywhere on social media. Look at our website. You can get any information about what's going on in the community from any of those sources. You can also send us questions. If you want to tweet me, go ahead. I'll still answer it even though this is on tape. So first of all, we're starting off with things we've been doing out in the community.
Out and about in the community, we have been in Imperial actually 3 times this month for myself. At the beginning of the month, I attended the Farmworkers Coalition, which is a forum of various organizations, very broad-based, healthcare, employment, law enforcement, you name it. After a summer recession, they rejoined again to catch up on what's been happening and to be able to disseminate any updates and information for each one of these organizations to take back to its constituency and, you know, let them know what's going on in the county.
That's one of the best ways to get information out.
It is a very effective way of communicating.
Yes. Word of mouth, right?
Word of mouth, yes.
Great. I also heard you were with the Cancer Resource Center out there.
Yes, actually I went to listen to the results of a pilot study that was done with the breast cancer patients that access services, treatment services for breast cancer on both sides of the border. And the gist of that particular survey was to find out the best practices on either side and the things that could be improved upon. It was a very well organized workshop. It had much quality information, and best of all, we were able to hear from the cancer patients themselves. So it was quality information that really is going to give the oncologists and the healthcare system on both sides of the border, because we have representation from both sides of the border, ways to go back to the drawing board and see how they can improve the services for these women.
Well, I know Deanna has talked a little bit about one of the patient's stories that, you know, she was given the diagnosis of breast cancer and then was told, we'll see you in 3 months.
Yes, it is so traumatizing, and you know, the last speaker gave her life story of what, you know, she had to go through, and she conveyed the message in such in an emotional way, but not in a tear-jerking kind of way, but very realistically saying, you know, how her world was being turned upside down, and how they were telling her, you know, that maybe 3 or 4 months down the road, and possibly having to come all the way to San Diego to get to the first oncology appointment. So it was devastating, and I think the professionals there got the picture loud and clear.
You know, unfortunately, that's kind of a common scenario. You hear a lot of people talk about that no matter where they are, that trying to access the healthcare system can mean months waiting.
Absolutely, but I think that's going to be improved, I think, at least for that particular patient load.
Yeah, yeah, I think that's great. You know, kind of on the flip side of those kinds of opportunities that we have in the community, I was at the Adaptive Business Leaders meeting the other day, and they were actually looking at what people are doing in our community to make it more connected and healthier. So I was talking about kind of the fundraising, the philanthropic dollars that are available, and what we're doing here at Alliance Healthcare Foundation to provide connectivity. But also Nick Machione, who's the director of the Health and Human Services for the County of San Diego, Dan Chavez, who is the executive director of the San Diego Regional Health Information Exchange, as well as John Ohanian, who is the executive director of the 211 San Diego. Actually, I think he's president and CEO. But anyway, I'll demote him for just a moment. But they were all there and talking about kind of what they're doing to make the community more connected, and imagining the time, you know, out there, and hopefully not too far future, where you could actually call 211 San Diego to get information, and just like that, they would know where there's an open bed, where there's good food, where there's a doctor's appointment, where there's, you know, and get you connected. Right now they get you connected in an amazing way, but this would really be real-time kinds of information.
Oh, that would be a dream come true. How wonderful would that be?
That would be just really awesome. There's other things that were going on with Alliance Healthcare Foundation as well. In fact, you've got a great seminar going on next week,
Yes,
right?
next Tuesday we're having the social media seminar. It's a very interactive seminar. We have a great leader to facilitate that seminar.
That's that guy right behind the camera,
The guy
right?
behind the camera. And actually, you know, last year we had grantees only from San Diego. This time around we have 8 grantees from El Centro. They're very excited about it because, as you know, connectivity is not the norm in Imperial County. So these men and women are gung-ho about coming to this seminar. So I'm really looking forward to it. In addition, that they will also get to meet each other for the first time for this crop of 2013 mission support grantees.
It will be very interesting. Yes, 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 yes. Also later on this month, I'm going to be going out to the Center for Community Solutions Chef Showdown.
Your turn.
I know, my turn. It's always fun to be out there, but you know, most importantly, it's good to see that we're out there supporting the grantees and past grantees and the efforts that they're doing to fundraise and just talk to people about what the great work is that these organizations are doing.
Yes, and also on our webpage, you're going to be able to see all of the events that our grantees are going to be having in this month. And September is full of activities. A new path has Strut for Sobriety. The Bayside Community Center has the art gallery for youth. They're going to have a reception on that. And then the South Bay Community Services has their annual gala. I mean, you name it. Go to our website and you're going to be able to see all of the different events that you can support that our grantees will be holding in the month of September.
We also share that on Facebook, so you can always look at Facebook and get the links to the events that are going on with our grantees.
Right.
So we try to share that as well. Going back to Imperial, you just did a great workshop out there with ACA and Covered California.
Yes, I couldn't be happier with the turnout that we had, with the interest that we sparked. And then as a bonus, tomorrow, Assemblyman Victor Manuel Perez is going to have another Affordable Care Act town hall meeting in Imperial. And hey, I mean, I think we had a little bit to do with that, you know.
Well, we did have a representative at our meeting,
Absolutely.
right? Yes,
Yes,
absolutely. But, you know, I think what's really, I guess, sad in some ways is that that whole idea to do that particular meeting out there came about because it was clear that Imperial County was not getting the same kind of information about the Affordable Care Act nor Covered California that we're getting here in San Diego. So really was grateful that we were able to put together the key people to present that information.
And I think it was a workshop that was organized based on the input that we got from the leadership in Imperial County. So it wasn't something, you know, that we dreamt and we decided to do, but it was really logical based on what their needs are. So I was very happy with that. Yeah, that's her brainchild. But the rest of the information came from the leaders.
But I didn't dream what actually happened down there. I tell you, it was really great turnout and great information. And that really gives us a great segue into our guest today. We have guests today.
Yes,
Did you know
we
that?
do. Yes, we do.
We have guests today. We have from 211 San Diego, Camey Christenson, who's their development consultant, and Karis Grounds, who is the health programs manager. We're going to move over so that they can join us because they're going to tell you a lot more about Covered California and what 211 San Diego is doing. And it will be very interesting.
Thank you, Sylvia. Thank you, Nancy.
Well, welcome. We're so glad that you could join us today.
Thank you so much.
Are we all happy?
Yeah,
So tell us a little bit about what's going on. Why are you guys involved in this and what's going on?
Well, we found that there's lots of different messaging about Affordable Care Act, and folks don't know what that is, and there's lots of confusion, and some people call it Obamacare, ACA, and so we at 201 San Diego received a grant from Covered California, and all of our staff are certified educators.
Wow.
So we sent all of our staff to 3-day training, and so we're really working on getting the message out on what Affordable Care Act is, what are the changes coming to the insurance, and how folks can get more information. Absolutely. The Affordable Care Act was a law that was signed in March 2010. And so fast forward to today, beginning in October, open enrollment starts, October 1st. It's coming very quickly, so we want to get the message out. And the significant changes that come into play with the Affordable Care Act is the creation of state exchanges. And what that means for us here in California, that's called Covered California. So you'll be hearing a lot more of that Covered California has a great website. That's the entity where it's an exchange where folks can purchase qualified health plans. Other changes with the ACA is that now dependents, families with dependents, can keep coverage for up to age 26. No one can be denied coverage because of pre-existing conditions.
That's going to be huge.
That's
huge. That's really, it's already in play right now, and that's just so huge for people that lost their insurance or they reached their max and, all of that kind of stuff. So I think that one's a really huge one.
It is, and there's no annual max, there's no lifetime maximums, and so that's a huge component too. And I know that that's going to be life-changing for many folks that we talk to. And we get the call. We're getting the calls now, and and I think some folks are confused. So we're really hoping to get the message out that if you're confused, call 2-in-1 San Diego. Look on our website, contact Covered California, and there's lots of changes. And Karis can talk more about what we're doing specifically of activities that we're doing in the community.
Yeah. So as we've been discussing, we are certified in education and outreach. So we're providing 24/7 over the phone outreach and education, as well as going to community events in San Diego and Imperial. So we want to get out in the community, we want to spread the word and let people know about what's going on. So essentially, if you call in, you can, after you pick your language, you can press 3 and you can talk to someone directly about what Covered California is and what it means to you, how much roughly it would cost for you and your family if you give them your household size and your income and your zip code and your ages. You're able to get a basic idea of how affordable it is, and then kind of the process and the steps through of how to, if you do want to enroll, we can send you to Covered California and be able to have someone follow up with you. So it's like a whole system, and we want to be able to give you the education to have the tools to make a knowledgeable decision about how you can get healthcare. So it's a really great opportunity, and we encourage people to call, send your clients our way, and we would love to talk to them about.
Do people
what's
have to
going on.
do this by October 1, or is it starting and then it goes for a while, or what's going to happen?
So open enrollment starts October 1st and it runs all the way through March 31st. But you have to have your insurance by January 1st. So that's why they're encouraging people to enroll now, get the information you need, and get in the system. So come January 1, you're going to have insurance and you're ready to see your doctors.
Is the deadline January or March of 2014?
Go ahead.
Oh, March is the that's when you can enroll up into March.
Up until.
You're able to
March.
enroll up until March, yeah.
With the Affordable Care Act, there is now, everyone's mandated to have, or most people, I shouldn't say everyone, there is a subset that are eliminated, but most people are required to have insurance, and if you don't, then it'll, it's time to file taxes, you'll be given a fee of either, for the first year, $95 or 1% of your income, and then it gradually increases over years.
And that's probably what I see that most people are unaware of.
Right.
You know, because if you have, the group that is going to be qualifying for the Medicaid expansion per se, there's going to be people that are going to be transitioning, for example, in Imperial County, that are Medi-Cal recipients right now. And they don't understand that there is going to be a penalty if they don't choose a health plan.
Right.
And that it's going to cost them. And I think that's one of the things that very few people I've heard can make any sense of it. All of the radio ads, because I've listened to quite a bit of them, it's very easy to follow and comprehend, but it just depends if you're listening to the spot for it to make sense to you. But people that don't have the opportunity to listen to areas, for example, like Imperial County, that those ads are not out in the airwaves, they don't have a clue about this penalty.
Yeah, it's very important. So we definitely are trying to educate people about the penalties and the risks in not getting insurance and how expensive it could be if you do break your leg or go to a hospital. It can be up to $30,000 in the benefits to paying this premium versus paying a huge hospital bill. You have to kind of weigh your options. Hopefully people agree that it's important to have health insurance. So.
And there are folks that have up to 400% of the poverty level will get financial assistance that will help them cover their premium assistance or their share of cost. So that's really important that you can go on to coveredca.com. There's a calculator there, plug in your information, and it'll tell you how much financial assistance you're eligible for, how much out-of-pocket expense it will be. You have different options. There's bronze, silver, gold, platinum, different options that you can you can qualify for.
Well, I think even this discussion begins to, kind of outline how confusing it can get, because there are so many details, and then if it's this, then it's this, and if it's
Right.
that, then you can choose this or choose that. I think that's why it's so great that there's 211 that people can call, just 3 letters, 3 numbers. Those aren't letters, Nancy. 3 numbers, and you can get assistance, you can get information. People will sit there on the phone and answer your questions. So I think that that's really critical that we have that in our community. And available. So what else do people need to know? I know y'all had 4 slides. Have y'all gone through all 4
We
slides?
haven't gone through all of our slides, but we can talk about, I guess, who we're marketing and who we're targeting, and I guess that would just depend on who your clients are and who you're talking to, because Young Invincibles is one of the names that they call it. So young people that haven't really had insurance before are starting, they need to have insurance. So having them realize how expensive it is if, they're out kite surfing or something and break their leg.
Because they're the ones that don't
Yeah.
think they're at risk for getting hurt, right? They don't think they're invincible.
Yeah, so
Yeah.
there's that population versus we have like working families and the importance of taking pride of your family and being able to protect them, as well as one of the 10 essential benefits that the ACA is now mandating is preventative care. So you'd be able to take your family to the doctor for free and be able to make sure that they're getting those regular checkups and those kind of things. And then we also have the aging and at risk populations, or the people that have been denied before. And since there's this new program that you can't be denied if you have a pre-existing condition, is just going to be amazing for people in that population. So being able to kind of reach those different populations and explaining the benefits to you is just a great opportunity.
And that latter group is probably given up. Right.
Right.
They're probably not even paying attention
Right.
because they're not
Yeah.
eligible. They've been not eligible for quite a while, and they're always like, oh, whatever, they're changing that, whatever. It's still not going to apply to me.
Right.
So it'd be important, especially for them, to get this information.
Absolutely. So all we have left to cover is just where to find more information, and call 201 San Diego. We're 24/7 available to answer all of your questions about Covered California. You can check out our website. We also have there's a link to the local events in Imperial and in San Diego, so you'll be able to check that out and just attend one and come to our booth, and we'll be able to go through the calculator with you or answer any questions, as well as just checking out covercalifornia.com. You can go through it yourself and look and see how affordable it is. So there's lots of options.
How many languages do you have available at 211?
Over 200.
Right.
Wow, that's
So
great.
we most people are bilingual, but we have a language line to be able to do any language. So.
And I think that was a really key part to this whole change, right, in Affordable Care Act, was the emphasis on prevention and things that people might not think of as prevention, like immunizations. That is a part of the prevention series that's available through the Affordable Care Act, through Covered California and these plans, so that people aren't, they may have other reasons why they choose not to get an immunization, but it won't be cost. It won't be because the insurance doesn't cover it. It will be there for them to choose.
Exactly.
Yeah, it's exciting. It's really exciting. So, and always just also the calculator is just this really easy tool that you'll be able to kind of get these ideas and the coverage and all those kind of ways to understand it. So, and we do that over the phone too. So we're able to essentially explain all the different parts of it and the differences between HMO and PPO and EPO and all these different language terms that might be, we personalize those calls. So you're able to get, what you want out of that call and what you want to learn from Covered California. So that's.
Well, I really appreciate y'all being here. And if there's anything that you remember out of all of this, it's the numbers, not the letters. Remember the numbers, 211. Give them a call, because all this information, there's a lot of information. We can all do it together. You ready? 211. That's right. Give them a call. Thank you guys for being here.
Thanks
I
so
really
much for having
appreciate
us.
it.
Fun having you.
Absolutely. And thank you all for being here again. You can always follow us like us on Facebook, connect with us on LinkedIn. Get the thumbs working and send us a tweet, send us your questions, check us out on our website, and as always, join us again next month. Thank you so much.
Bye-bye.
Bye.
Bye.